Hi, hello everyone. Myself Basavaraj, working as a nursing officer in Jipmer, Pondicherry. So I am here to give you some brief introduction about that Jipmer skill test. Students who are going to prepare for the skill test, they can see this video and have some idea about the skill test. Okay, so if people are having so many doubts regarding the skill test, so I am just trying to clear you the doubts of the skill test. So first one is, what is skill test? So skill test is they are going to conduct when you people clear your CBT. After clearing your CBT, they will call for the skill test 1:3 ratio or 1:4 ratio. So the members will come for the skill test. Once you clear the skill test as well as your CBT examination, then only they will consider you as a selected candidate. So clearing skill test is very much important. So I will tell you the doubts regarding whatever the doubts people are having. I will try to clear it out. So we'll starting from the first. Second point is, only practical experienced people can clear this exam, or the pressure also can clear. What about the pressure? Pressures also can clear this exam, and practically experienced people also can clear this exam. The thing is, practically experienced people can feel bit easy comparing to the pressures. But pressure also can clear, no problem in that. If you people do the thorough preparation about the skill test, then you can clear. So there is no rules like pressures can't clear this examination. So what will be the duration of this examination? So the duration of the examination will be 25 minutes, 20 to 25 minutes. The duration of the examination is 20 to 25 minutes. So this examination is like our practical examination. So you will be getting total 20 to 25 minutes. Next question is, how many stations will be there in the skill test? So in the skill test there will be 4 stations. In the skill test there will be 4 stations. These 4 stations, for every station they will be getting some 5 minutes. So it may be 20 to 25 minutes skill test only. Within 20 to 25 minutes your skill test is going to over. So what will be the duration of each test? Okay, that each stage the duration will be 5 minutes. So each stage duration will be 5 minutes. So if you are appearing the examination, so there will be the 4 stations. Among the 4 stations, there will be first station will be 5 minutes, second will be 5 minutes, third will be 5 minutes, and fourth will be 5 minutes. So once the 5 minutes gets over, and there will be a bell, and after that next you should run to the next station. After that again 5 minutes, again one more bell will ring. After that again you should go for the next station. So there will be getting 4 bells. So within that 4 bells your exam is going to finish. So once the examination starts, all 4 people will come inside, and the 4 people will go to particular 4 stations. And once the bell will ring, next that time you should rotate. So as in rotatory motion, 4 people will finish the skill test at the same time. Okay, so total how many marks will be there? The total marks of the skill test will be 100 marks. Total marks will be 100. Among the 100, 50 marks if you take, you will be qualified. Okay, so total marks will be 100. So each station is containing 25 marks. Okay, so the 4 stations, each station will be containing 25 marks, total 100 marks. So the marks required to qualify in the skill test, the marks required to qualify in the skill test is 50 marks. Okay, the marks required for qualifying the skill test is 50 marks. So how many candidates may appear the skill test? The candidates may appear the skill test that based on how many people are qualified in the CBT examination. In that CBT examination, the number of people qualified, and they will take according to the number of vacancy in some 1:2 or 1:3 or 1:4 ratio. So this 1:3 or 1:4 ratio, in regarding to the number of vacancies, they should come and they should appear the examination, and they will give you some schedule. So that schedule will be announcing soon. So according to that schedule, for some people it will be day 1, for some people it will be day 2, some people it will be day 3, like that. Based on that your rank, you will be appearing the examination. So next, how the final selection list will be. So the final selection list will be based on your CBT as well as your skill test. In your CBT, if you are getting your rank, so you have to qualify your skill test. So if you are not qualifying in your skill test but you have a great CBT rank, still you are disqualified. So whatever the rank is, you have to qualify your skill test. So skill test qualifying only for 50 marks. The total examination will be 100 marks, but you should qualify the skill test. That you should, if you take 50 marks, then you will be qualified. Okay, so after that I will give some brief introduction about that main part, the total stations. The total will be, there will be the 4 station. In that 4 station they are going to conduct, the first one is procedure 1, second is procedure 2, third is calculation part, fourth is instrument identification parts. Okay, so this procedure 1, you will be getting 5 minutes. In that 5 minutes you should finish that procedure. And next second station is also one more procedure. And the third station is calculation part. In the calculation part there will be 2 sums which you should finish in 5 minutes, and for that you will be getting 25 marks. And fourth session instruments. Then instruments, there will be keeping some 7 to 8 instruments, and 2 image based questions, so there will be some instrument line by line. So like this instruments will be there. So you will be getting that one paper. In that one paper you should name the instrument. Number 1 instrument is Alice, and number 2 artery, number 3 thumb forceps. Like that you just need to label the instrument. So if you are labeling the instrument according to that number, so you will be getting the marks. And 2 image based questions will be there. Sometimes they will be asking some delusion of persecution image, delusion of reference image, delusion of grandiosity image, or some personality disorder image. Like that, how we used to prepare for our CBT image based questions. Like that image based question may come, because last time they conducted like that only, and don't know about this time, but most probably it will be there. And image based questions, some CHN questions also there. CHN community health nursing. In CHN community health nursing questions also will be there. In community health nursing question, what it will be happening means, in community health nursing there may be a logo image, or there may be a developmental goals image, or there may be any image which will be coming in our CHN, they may place. So there is not sure that they will be keeping that CBT from only, they will be keeping image based question only from community, only from psychiatry, not like that. So they may take from anywhere, and they will keep for 2 image based questions. So you need to identify the instrument name, and you should list out properly according to their order. So in that order, according to that, number 1 image is this, number 2 is this, number 3 is post. So like that 4 image you should write. Okay, like that total 10 images will be there, 10 instrument you have to write. Okay, last time is they didn't ask about the uses and all of that image. Just we need to identify the image name. Okay, so we should write the image, identifying image and writing that image. Sometimes they ask that metal tracheostomy tube, sometimes they will ask some hospital instruments. So not sure from where they will be asking, but better to prepare everything properly. Okay, so in first one is procedure 1. In the procedure 1 there will be intradermal injection, intramuscular injection, IV cannulation, like that they may ask. And second question may be like other also one, that means also one more is also that procedure only, maybe CPR, catheterization, collection of sample from the catheter. So like this it will be there, 2 sessions. And third part is calculation part. In calculation, drug calculation will be there. You can study properly about the drug calculation, maybe pediatric dosage calculation or a normal adult calculation. And in that dopamine calculation, vitamin, adrenaline, noradrenaline, that inotropic calculation they may ask. So you better to prepare properly for that. And one more is BI, body mass index calculation, Burns calculation. So whatever the calculation part will come in our nursing, so you better prepare everything so you can give a good exam. After that, instrument. In instrument, I told you about surgical instrument they may conduct, OBG instrument and Anto instrument. After that, some 2 image based questions. That image based questions of maybe of our nursing subject, any image based questions they may ask. So if you preparing properly for CBT examination, that image based question, these image based questions also you can write properly. So this is the just overview of our skill test, how they may conduct. So better have a plan about that skill test examination, and prepare according to your plan. Don't read some YouTubes, don't just see them YouTube procedures and read and come here. So better prepare properly each and every procedure. You should be knowing of all the procedures, and one more thing, whatever the procedure you are reading, you just have a concern that you should finish that procedure in 5 minutes. Examiner will be there. That examiner will be seeing you, that you should perform in front of them. So you can explain, along with that you can do the procedure, because you will be doing something else and they will be understanding something else. Some examiners will be giving you some good response, some examiners will not be seeing you, but you have to give your explanation properly and you should do it within the 5 minutes. So if you are reading any procedure, plan properly how to finish this procedure within 5 minutes, so you can practice properly and come. So that is the procedure part, and in that procedure part I will tell you in how to prepare for the skill test. I will tell you in next video. Introduction is like there will be 4 stations. First procedure 1, there will be procedure 2, second station, calculation part, third station, instrument identification part is fourth station. Like this they have conducted previously for us, and I hope so this time also they may conduct the same. So this is the just brief introduction. So every 5 minutes bell will be ringing. So next you should go for the next station. After 5 minutes again you should go for the next station. Like that there will be every 5 minutes next station you should run. Don't make it very complex while preparing for the skill test, and don't be very much negligible also. So have a proper plan and see what are the important procedure in our nursing, prepare for that, and while reading just imagine how you will be doing in that examination center. Okay, so don't be panic about the skill test. Give your best, and I will tell you how to prepare for your skill test in my next video. And then see you all. Take care. Bye bye.